We shall be talking about evaluation of diagnostic tests in this lecture. This is a very important high-yield concept often tested on the USMLE exam, so you need to know this very cold. So in medicine, we always perform tests, like you order a test and you want to know because you have a clinical suspicion for a disease. Let's say a patient comes in complaining of mid-epigastric pain radiating to their back. And your suspicion is and they tell you in history they've been drinking a lot of alcohol. You're suspecting pancreatitis. So you decide to order a test called a lipase test. And based on that test, you want to confirm if that patient is positive with elevated lipase, you say, hey, you have pancreatitis, right? If it's negative, it may be just they don't have pancreatitis.
Hey, I see you taking a lot of notes while you're watching my YouTube video. I hope you're enjoying it, but there's only one problem. First, you've been watching all my lecture video content for free, but only 52% of people who are actually watching my YouTube channel have actually subscribed. Now, the other 48%, you might be one of them, but I'm not sure, so I'm not gonna judge. But can you do me just one favor? My goal in this channel is to bring you more content every single time so that you can have access to free quality education. However, in order for my videos to help millions of people around the world, I just need a favor. Can you help me get the number of that 48%? We can get it down so that we can get more subscribers to this channel so we can help millions of people around the world. So do me a favor, smash that like, subscribe button and share my videos to your friends and comment below, all right? I really appreciate it. And just because you have decided to do that, I promise you I'll make more videos. Thank you. You rock, you're awesome. All right, do me a favor, just smash that like and subscribe and then also share my video to the rest of the world. I appreciate you so much for helping me grow my channel. God bless you. Have a good one. All right, okay. Now, you can go back to taking your notes inside my lecture because the rest of this lecture is gonna be amazing. So you don't wanna miss it. Let's continue. Oh, one more thing I almost forgot. Yes, what I told you, you haven't done it yet. I can tell. Just smash the like and subscribe button and subscribe to my channel. Thank you. You rock.
So that is kind of the idea behind evaluation of diagnostic tests. And because these diagnostic tests are not 100%, we have to know the sensitivity, meaning how sensitive the test is, or even how specific the test is, and the board wants you to know this. Now, this is very easy, but we need to understand some concepts and some terms. You need to know what a true positive is, a true negative, false positive, and a false negative is. If you order a test for a disease and that test comes back positive for the disease, then it is true and it came back positive. That is a true positive test. If you order a test for that disease, in this case pancreatitis that we're thinking about, and that test came back negative, they have a normal lipase, you say the patient doesn't have pancreatitis. That is a true negative test. However, we have a false positive test. And a false positive is when the disease is absent, but the test came back positive. For example, the patient does not have pancreatitis, right? But the test came back positive. You probably see, oh wow, look at that. It looks like you have pancreatitis, but the patient actually does not. That is a false alarm. Now, a false negative test is basically when a patient has the disease, but the test came back negative. You don't want that. You suspect that the patient has pancreatitis. You order a lipase level, and the patient test came back negative, fooling you, making you think that the patient doesn't have pancreatitis, but the patient truly does have pancreatitis. That is known as a false negative test. This is an incorrect result.
Hey, real quick, before you continue watching your lectures, are you struggling with pharmacology? Do you hate mechanism of actions of drugs? Do you hate side effects? Do you not know how to memorize or know how to be able to use the right drug to treat conditions on your USMLE exam? Listen, I've got something special for you. Now, this is not for everyone, only students who are struggling with pharmacology. I have created a free USMLE masterclass specifically addressing how to answer pharmacology questions, how to be able to remember all the drug names, their classes, and also know how to treat the right condition on your board exam. This is so easy. This is the exact blueprint that I personally use to be able to answer all my pharm questions and got all those questions right on my board exam. Now I'm a practicing physician in emergency medicine, and now I know exact drugs to use to treat all my patients. And I want you to get exact blueprint today. I have a free USMLE Pharmacology Masterclass where I'm going to be showing you those exact secrets that I personally use. All you simply have to do is grab a copy of my workbook and also register for my free Pharmacology Masterclass. Inside the class, I'm going to bring out step-by-step, easy mnemonics to remember drug classes, exactly what they always test on pharmacology questions on the board exam. And I'm going to also show you how to be able to identify concepts that the USMLE exam writers are actually looking for so you can use the right drugs to be able to treat the right conditions. Listen, it's so packed with so much information that you are going to love. All you have to do right now is click the link in the description below and grab my copy of my free pharmacology workbook and also register for my pharmacology masterclass. And you are going to absolutely love it. Click the link right now, grab my free gift for you, and register for the free pharm class.
Asha from UAE. I'm currently at my dorms, university, which is kind of like an hour away from Dubai. I'm in my final year in medicine. Initially, I was planning to take it when I finish my 4th year. So medicine here is like 6 years. And then once you're done with your 4th year, you start going to the hospital and doing rotations. So I wanted to do it before going to the hospital or starting doing rounds. So I was like, I'll finish my 4th year and I'll take it. Because we also have like yearly exams that are kind of, they test us on what we have taken in those 2 years. And so we had an exam and I was like, I'm going to study for that exam. And then one time, because it's like similar to USMLE, I'm going to take it. And I did that and I failed the first time. And and then I was like, there's no way I'm going to pass the exam again, because the first time it was so long. I was so stressed. I was completely unprepared. The way I studied was like completely wrong. And I kind of started losing hope. And then, which is weirdly, my sister saw an ad of you on Instagram, and then she forwarded it to me. And then I was like, fine, I'll just give it a try. What's the worst thing that can happen? And I did. And yeah, I started studying in my summer break when I finished my 5th year. And when you finish your 5th year, you have to do an external elective. So I was doing my elective in the States. And during that month, I was studying for step 1. And when I came back, I continued studying for it. And then a few weeks ago, I took it and I passed. You guys like focus. For example, when I did cardio on my own, I would study like diagnosis and treatment and management, which is kind of more of a USMLE step 2 thing. But in the course, you guys focused on like small details and things that step 1 would ask about. And you also pointed out certain things that I would have never thought of, focusing on, because I was like, that's trivial, no one's gonna ask that. But then you guys pointed those things out, and there were like tips and tricks on how to, study. And I thought that was very helpful. I was actually in class and the class was running late, and I was so anxious because I know the marks are out every Wednesday. And I was waiting for the class to end, so to go and like they send you an email whatsoever. And I got the email in class, and the first person I texted were my friends, and I was like, guys, I got the email, but I'm not going to open it because I'm in class and I don't want to have a mental breakdown in the class because I'm kind of sure I'm going to fail. And then they were like, no, just leave the class, leave in the middle of the class and come. And I was like, no, I can't leave class because the doctor is explaining, that would be rude. Then the class was over. I left, went straight to them. And then we opened it together and it said pass. And everyone started screaming, but it was like a good, joyful moment. My parents were really happy. My mom was like, I knew you were going to pass. So that's like not a surprise. And yeah, they were really glad. I would definitely recommend it. And I actually have a lot of friends who are planning on taking their step 1 and I've recommended Smash USMLE to them. And it's really structured instead of like being lost and using your own sources and whatsoever. I hope I started with Smash USMLE because I'm pretty sure if I started with that the first time, I would have passed. But yeah, so I would highly recommend it.
Now that we've understand that concept, the most important part of statistical analysis when it comes to evaluation of this diagnostic test on the board exam is learning how to draw a 2x2 table. This will save your life. So let's learn how to draw a 2x2 table because we're going to talk about sensitivity. So basically, this is how you draw a 2x2 table. 1, 2, 1, 2. Okay, 2x2. And at the top here, I like to write the truth. Why do you care about the truth? Because the truth is the disease. All right? Because that's what we care about. Because healthy people don't care. We only care about the people that are sick in medicine. All right? And what we need to do is order a test. So if I order a test, what do I want to know? Does the test come back positive or it comes back negative? And what I need to know is, does the patient have the disease or they do not have the disease? So let's say, have disease or no disease. That's it. That's all we really care about in medicine. That's why you're going to be a physician, because that's your job to find out who's sick and who is not sick. Now, let's try to put in these terminologies inside this 2x2 table. If you order a test and the test came back positive for the patient and they have a disease, that is a true positive test. We're going to represent by TP, right? So in this case, I said the patient has pancreatitis. Lipase level is super duper elevated. Positive. You say, yes, see, you have pancreatitis. In true negative, right, you order a test and the test came back negative, right? And the patient does not have the disease. So that is good. It's truly negative. That's a great test, right? Now, how about if we not order the test? The test came back positive. This is the test. It came back positive, but the patient does not have the disease. That means it's false. So that's where we put our false positive. That's a false positive test, right? So it's like somebody telling the patient, guess what? You have HIV. And the patient does not. That's the last thing the patient want to hear, because the test came back positive for HIV, but maybe it wasn't that test. And that is a false positive test. Imagine a test like that. That would scare a lot of patients. And then the last but not the least, a patient actually have the disease, but the test fails to find out or test positive. So it came back false negative. Okay? That is a false negative test. In that case, you're going to miss the disease because the patient does have the disease. And it came to you complaining, I got pain going down to my back. I think you have pancreatitis, but I don't know. Your lipase came back normal. Okay? That is how you fill in the box for a 2x2 table. Now, what I want you to pay attention to on this table the most is the most important part of the table is the top part, not this part. We don't really care much about the test, right? We do a little bit, but the most important is to know if the patient has disease or not. So, now let's talk about the sensitivity of a test. Now, in order to understand sensitivity, you need to know the definition. And I don't want you to get caught up in the numbers, okay? You learn and master the definition of sensitivity, and you can answer any board question, okay? So sensitivity, or a true positive rate, by definition, is the proportion of people with disease who test positive for the disease. So let's write the definition. Proportion of people who test positive and have the disease. So let's look at our 2x2 table. we said if I order a test and it's positive and the patient has the disease, that is a true positive test. That is what we are looking for in sensitivity. Another definition is the probability that a test actually detects a disease when the disease is there. So we're like, what is the probability that you are going to have a positive test if you actually have the disease? Or the way I like to see it is, if I'm sick and I have a disease and I order a test, the test is going to test positive and basically catch all the sick people. That is what sensitivity is all about, okay? Now, we use sensitivity to rule out disease, right? Because if I order a test and the test is supposed, if we got a big piece of pie, right, and there's a test, so let's say there's a big piece of pie here, and there's a test that can tell me, look, all these people have the disease and they test positive for the disease. That is a great test. So a test that is 100% sensitive would be like a great test, right? It's going to catch all the people that have the disease. So how do we determine the formula for sensitivity? Remember, it's a rule out test. It rules out the disease. So in order to determine sensitivity, using the 2x2 table, sensitivity, I'm going to write by SN, is the true positive test, okay, divided by the total amount of people who test positive and the false negative. So basically you come down like this, and this is going to give you sensitivity. True positive plus the false negative. Okay? That is the formula for sensitivity. Now, on the boards, they're going to test you in clinical vignette. And on the left-hand side of the board, I have written out a question we're going to use to calculate sensitivity and specificity when we get there. Okay? So let's look at this problem-based learning question. 200 patients are enrolled in a study to evaluate the accuracy of a new ELISA test. The test is for influenza. 100 patients were diagnosed with influenza by the reference standard culture of respiratory secretions, and 80 of those patients with influenza had a positive ELISA-based test, as did 5 patients without influenza. Calculate the sensitivity of this test. So let's fill out the 2x2 table. This is how they're going to present it to you on the exam day. So 200 patients were enrolled total for the study. So we have 200 total number of people, okay? So total is 200, okay? And they said 100 patients were diagnosed with influenza. So this is the disease. Remember, we only care about the disease column right here, influenza. 100 patients. Okay, that is the total number. This is the column for the disease. Remember, this is the column without the disease. So out of this 100 patients that were diagnosed with influenza, 80 patients, so read the questions very carefully, 80 of the patients with influenza had a positive test. What does that mean? That's the true definition of a true positive. Let's look at here. Check right there. True positive. I order a test, it comes back positive, and the patient has the disease. 80. Now, in order for this to add up to 100, automatically 100 minus 80 will give you 20. So that's how you fill that column. Now let's try to fill this column. And then the question goes ahead and said 5 patients without influenza tested positive for the disease. So they tested positive, but they did not have influenza, right? So unfortunately, that is 5 of them. Now, you probably wonder, how am I going to figure out what number goes in here? At the beginning of the question, we have 200 people in the entire study population. They will always give you that number, which means 200 minus 100 will be 100. Which means now, in the no disease column, If 5 people tested positive for the disease, but they don't have influenza, it's like telling somebody, you got the flu. And they're like, the doc told me I got the flu. But guess what? You don't have the flu. All right? So 100 minus 5 will be 95. All right? So now as you can see, we've filled out our 2 by 2 table. Now it becomes a very easy question. Calculate the sensitivity. So what is sensitivity? The formula for sensitivity is the total number of people that tested positive disease, that has the disease, true positive, which is 80, divided by the total number of people with the disease, which is true positive plus false negative, with this column, this row, and this row. And all we got is 80 plus 20, which is 100. 80 over 100 is 80%. So the question is, what does that mean? Well, this basically means the test is 80% sensitive, which means, going back to the definition of sensitivity, proportion of people who tested positive for the disease that have the disease, which means 80% of the time, out of 100 people, this test is going to catch 80 people out of 100 that have the disease, and it's going to test positive. In other words, it also means it's going to miss 20% of people that actually have the disease, but it's not going to catch them. So it's going to miss 20% miss rate. Okay? That is what 80% sensitivity of a test is. Okay? Not too bad of a test. We're catching 8 out of 10 people or 80 out of 100. We only miss 2 people. For every 10 people that come to the studio office, you're going to miss 2 people that actually have the disease, but you're going to catch 8 out of 10 of them. Okay? That is basically what sensitivity means. A nice mnemonic to remember for sensitivity is sensitivity rules out. Okay? So you can write it as sensitivity, S-N-O-U-T. Okay? But for me, personally, I want you to know the definition, because then you can remember how to answer the question on the board exam. So in summary, for sensitivity, this is a test. We want to create a test that has a very, very high sensitivity. Why? Because it's used as a screening test to screen out diseases with low prevalence. Now, in order for that to happen, we have to have a false negative rate of 0. What does that mean? Well, if a test is 100% sensitive, in order for that to happen on this 2 by 2 table, it has to be 100 true positive, 0 false negative, which gives us a 100% sensitive rate for a disease, for a test to be able to determine a disease. So the lower the false negative rate, the higher the sensitivity of the test. That's why another formula for sensitivity is 1 minus false negative rate. So 1 minus false negative rate, which means if the false negative is 0, 1 minus 0 will be 1, which is equivalent to a 100% sensitive test. Okay? So if you ever see that formula, 1 minus false negative rate is because that is what's going to determine a test is 100% sensitive.
Thank you for watching this lecture video. I hope you enjoyed it. I would like to hear your thoughts in the comment section below about what you think about this lecture. And also, if you want to watch more lecture videos like this, click right here to watch more lecture videos like this. And don't forget to like and subscribe. You rock.